so that hinge point is T12L1. To thrust the ribs, usually those vertebrae are hinging like that. So yeah, try that in your body when you do that. So everybody just sit, as you're sitting here for a moment, feel your sit bones on whatever support you've got. Try to feel like you're on the bottom tips of the sit bones. And then for a moment, just let your ribs relax down. You're not forcing them, you're not scrunching down, but you're just letting your ribs just kind of soften. You're letting your belly relax. And then take one hand. So if you guys can find these floating ribs at the back of your rib cage near the bottom, dig in there. Don't be shy. Try to find the spinous processes sticking out here. So whether or not you're actually on T12L1, it doesn't matter, but just somewhere in that area. And then now exaggerate a rib thrust. Lift your ribs. And do you feel what's happening back there? That's probably this, a little bit of this feeling, right? So do that a few times. So when you round, it opens, lift. Okay, so now we're thinking of that from T12L1. So now don't even worry about that. Think from your chest now. So everybody lift your chest to the ceiling and keep your hand back there. And then let your chest drop. Lift your chest. So do you see how the intention of the movement moved from back here, now we're asking ourselves to move the chest up. But did you notice, even though the intention of the movement was initiated from a different spot, it was still coming actually from the same place? Does that make sense?
Yeah.
Right? So now, so that's kind of where the rib thrust is coming from more of the hinge. But it's hard to tell until you actually see it on the skeleton, because otherwise, if you see it on somebody else's body, if you feel it in your own body, it just looks like you're opening. Right? It looks like I'm back bending and I'm opening, but I'm actually back hinging. I'm usually mostly spinal hinging from there. Bada bing, bada boom. So instead, thinking more about, so your question of this expansion at the front and what's happening, don't even, I think just think more hinge. This is, so
yeah, I guess if my ribs are moving, because that's compressing those two vertebrae.
Yeah.
Then that's hip thrust. Rib thrust.
Yeah.
But if it's moving out because I'm breathing.
Yes. Yes. So don't worry about, we want to be able to move our ribs when we breathe. But a healthy, the long and short of it, really short story of it is like a healthy rib cage. Like when you breathe in,
you should be able to move. Yeah. Like your ribs should go forward. It's just if that's.
It's not just these front ribs moving forward, but you can think of it like your ribs are like a basket. It's a rib basket, and so for a moment, let's just all take your hands onto the sides of the ribs for a moment, and so it's not that you're thinking when I breathe, these ribs should be moving forward. Think about it 360. So your little muscles in between your rib cage, your intercostal muscles are going to move, and what happens with the ribs actually, there's a little bit of this torsional movement. They're actually in a mobile rib cage. These ribs will move sort of like the gills of a fish. So if that's an image that helps you when you breathe. So it's not like I'm rib thrusting, opening, and everything's open, open, open. I'm settling my rib basket over my pelvis so that I can invite more of this 360 expansion, because now everybody try to breathe in a rib thrust. So put one hand back here and try to breathe into the back of the ribs. Yeah, it's really gross. Okay, so, and of course now let's exaggerate the rib drop, which is really just a slouch. Now try to breathe. Maybe not the same. So if you can find that neutral, so I'm not so concerned about, okay, are my ribs perfectly over top of my pelvis? Whatever. If you've lived in a rib thrust like this, invite your ribs just a little more down, and then now think, inviting the breath to be this 360 expansive way of moving.